Hello mga kaibigan! Welcome sa Insight Fusion, kung saan mas pinapalalim natin ang pag-unawa sa mga isyung may kinalaman sa kalusugan, politika at global events. Sa video na ito, tatalakayin natin ang kontrobersyal pero mahalagang pahayag ni Dr. Peter McCullough, isang kilalang doktor sa Amerika, tungkol sa COVID-19 vaccine at ang posibilidad ng heart inflammation o myocarditis. At para mas malinaw sa inyo, ipapakita rin natin ang mismong bahagi ng kanyang testimony sa US Senate. Si Dr. Peter McCullough ay isang cardiologist at internist na may higit 30 years na karanasan sa medisina. Isa siya sa mga pinakamaraming naisulat na artikulo tungkol sa COVID-19 sa buong mundo. Bilang doktor, sabi niya, "My role was to fight disease, preserve life, and do no harm." Noong November 19, 2020, tumestigo si Dr. McCullough sa US Senate. Pero bago pa man siya makapagsalita, tinawag agad ng isang senador, si Gary Peters, ang kanyang sasabihin na misinformation. Ikinagulat niya ito at ayon sa kanya, hindi pa siya nakakapagbigay ng analysis ay hinusgahan na agad. Sa pananaw niya, ito ay parang propaganda tactic. Sinisiraan agad ang isang eksperto para mawalan ng kredibilidad. Ang main topic niya noon ay myocarditis, pamamaga ng puso na ayon sa kanya ay may koneksyon sa mga COVID-19 vaccines, lalo na sa mRNA vaccines gaya ng Pfizer at Moderna. Dati, 2 lang ang nakita niyang kaso ng myocarditis. Pero mula nang magsimula ang mass vaccination, libo-libo na raw ang naging kaso na naitala at nasuri niya. Ibinahagi niya ang mga sumusunod na totoong kaso na nakapublish sa peer-reviewed medical journals. Sa Washington University, isang 42 years old na lalaki ang namatay 3 araw matapos mabakunahan ng Moderna. Sa Korea, isang binata ang namatay 8 oras matapos dalhin sa ospital, ilang araw lang matapos mabakunahan ng Pfizer. Sa Connecticut, 2 teenager, 16 at 17 years old, ay natagpo ang patay sa bahay. Ang resulta ng autopsy, vaccine-induced myocarditis. Sabi niya, "As a cardiologist, that doesn't even happen with heart attacks. This is very serious." Paliwanag niya, ang mRNA vaccines ay gumagamit ng genetic instructions para gumawa ng spike protein. Dito ang bahagi ng virus na inaasahang kikilalanin at lalabanan ng katawan. Pero problema, ang spike protein mismo ang nagdudulot ng pinsala, lalo na sa puso ng ilang tao. Sabi pa niya, hindi lahat ng bakuna ay pareho. May mga vial o batch na mas malakas ang epekto. Sabi niya, "Until the vaccines are stopped, we will continue to see new cases of acute myocarditis." At ayon sa kanya, 216 vaccine-related deaths ang naitala sa kanilang record sa loob ng 1 taon lang. At tanong niya, 4 na taon na ang nakalipas mula nagsimula ang vaccine campaign. Ano pa ang benepisyong nakukuha natin ngayon? Ilan pa ang kailangang mamatay? Ngayon, panoorin natin testimonya ni Dr. Peter McCullough.
Ranking Member Blumenthal, subcommittee members, it's an honor to present my insights, my analysis, my clinical experience on this very important topic. The first time I testified at Homeland Security and Governmental Affairs, before a word came out of my mouth, Minority Senator Gary Peters said, what America was about to hear was misinformation. I didn't even know what he was talking about. I had never heard that term before in academic medicine or in important deliberations. That's November 19th, 2020. What was he doing? He was using an old communist propaganda technique. He was attempting to gain leverage over me before a word ever came out of my mouth. We should never have our public servants ever try to gain leverage over anyone who is coming to Washington to help the nation on an important issue. As introduced, I'm an internist, I'm a cardiologist. I believe I'm the most published individual who's ever testified on matters related to COVID-19 in any of these hearings. I've seen and examined more patients. I've examined more data. And I'm one of the most published people on the topic in the world. And as a cardiologist, I can tell you, my role in this was to fight disease, preserve life, and above all, do no harm. Do no harm. Now, the topic today is myocarditis or heart damage from the COVID-19 vaccines. I'm a cardiologist. I know the topic well. I've examined thousands of patients with this problem. Thousands. Before the pandemic, I had 2 patients ever with this problem. There's 1,065 papers in the peer-reviewed literature on COVID vaccine myocarditis. So let me summarize them for you. The first one that came on my radar screen that was alarming came from Washington University in St. Louis, August 18th of 2021. The first author is Verma and colleagues, New England Journal of Medicine. 42-year-old man comes into Washington University Hospital with vaccine myocarditis. The infection is ruled out. It's the vaccine. He's in the hospital. This is one of our best hospitals in the United States. He dies 3 days after taking Moderna. They can't save him in the hospital.
Say, Dr. McCullough, move the microphone just a little bit away from you.
Then one was reported from Korea by Choi and colleagues. This is now a younger man. Just a few days after Pfizer, he comes in the hospital. He dies within 8 hours of being in the hospital. I can tell you, I'm a cardiologist. That doesn't even happen with heart attacks. He dies within 8 hours. I examined all of the slides and the images that the Koreans had showed us. It looked like somebody took a blowtorch to that heart. It was so completely fried with inflammation. His heart was destroyed. These cases, which were widely known at the time, should have gotten everyone's attention. Everyone should have been laser focused on this. We should never have someone die after taking a vaccine that's directly caused to the vaccine. Then Gill and colleagues, Connecticut, published in Archives of Pathology, 2 boys, aged 16 and 17, who die a few days after taking Pfizer. These are teenagers. They're found dead at home by their parents. They're absolutely horrified. They request an autopsy. They call in University of Michigan and University of Minnesota to look over what are they finding at autopsy. Conclusion, it's Pfizer COVID-19 vaccine myocarditis, unequivocal. These are autopsy-confirmed cases. So for all the mothers in the room, how would they feel if they found their children dead after taking a COVID-19 vaccine? This is in the peer-reviewed literature. This is not misinformation. Everyone should be paying attention to this. This is not conjecture. This is in the peer-reviewed literature. So we started to ask ourselves, what is going on? Turns out that Pfizer and Moderna and Janssen are the genetic code for the spike protein. The spike protein is the damaging part of the virus. The spike protein is loaded into the body and it causes tremendous damage in some. Acute myocarditis appears to have some genetic predilection, and all of the vials of the vaccine are not the same. But I can tell you, I'm concerned that until the vaccines are stopped, there will be cases of acute myocarditis. And to finish, we've had 216 vaccine deaths this year alone. So if the vaccine campaign continues, we have to look at what are we getting out of it now, 4.5 years of the campaign, and how many more people will die.
Hindi sinasabi ni Dr. McCullough na walang kwenta ang bakuna. Pero ang sinasabi niya, bakit parang ayaw natin pag-usapan ang mga side effect, lalo na kung ikinamamatay ito ng mga bata at kabataan. Ang tunay na siyensya ay hindi umiilag sa mga tanong. Dapat handa tayong pakinggan ang lahat ng impormasyon kahit hindi ito ang karaniwang naririnig. Dahil ang tunay na kaligtasan ay hindi lang sa benepisyo ng pagbakuna, kundi sa pag-alam kung ano ang ibabakuna. Tulad ng mga long-term adverse effects, side effects nito sa kalusugan. Ang tanong ay hindi lang kung effective ba ang bakuna, kundi ligtas ba ito para sa lahat. Ang mga pahayag ni Dr. Peter McCullough ay hindi para takutin, kundi para gisingin ang ating isip tungkol sa health risk na dulot ng mRNA COVID vaccines. Ikaw, anong tingin mo? Dapat bang seryosohin ang mga sinabi niya? I-comment mo ang opinion mo sa baba. Huwag kalimutang i-like ang video, i-share sa mga taong open-minded at huwag din kalimutang mag-subscribe. Manatiling mapanuri at manindigan sa katotohanan. Hanggang sa muli at salamat sa panonood.